Welcome back. This is part 2 of what is thyroid disorder. Okay, so we didn't want that first video to go too long, so we decided just make it into 2 parts. Okay, so this is going to talk about what are the actual thyroid symptoms patients experience. We kind of started touching on it on the last video, but really let's break it down. We explained that the thyroid is a metabolic gland, right? It is a hormone. It releases hormones, I should say. And these hormones affect a lot of different things in our body, and up to 200 different things if we number them, okay? So the first thing I want to talk about is your metabolism. What does that mean? So when we talk about metabolism, it's basically how your body burns calories, how it absorbs calories, how it manages your weight, how it tells your body when to stop putting weight on, when to start putting weight on, how to sleep, when to sleep, how to wake up, when to wake up, when should it make melatonin, when should it not make melatonin, right? How should it absorb things in your gut? All of those play a role in what we call the metabolism, okay? The important thing about thyroid gland is that this gland actually also affects your gut. In fact, the thyroid is affected by your gut, but the gut is also affected by your thyroid. So what that means is that the gut has to be able to convert your thyroid from your non-active, which we call the T4, to your active, which we call the T3. So when we are converting this properly, then our thyroid is able to do what it needs to do. If we're not converting well, we're not going to feel the effect of this hormone, okay? So GI tract has to be functioning well for your thyroid to function well. And what we find also is that when your thyroid is not functioning well, the gut does not function well. So one of the most common symptoms we see in patients that have thyroid dysfunction is irritable type symptoms. They either have too much constipation or too much diarrhea. They're going back and forth between the two, bloating, just feeling discomfort in the abdominal area. That is very common in patients with thyroid disease. So the other thing that we can see in patients with thyroid is body temperature regulation dysfunction, okay? So the body regulates your temperature and likes to keep it in a tight range, okay? So where we call that is somewhere around 98.6, we consider that normal body temperature. Where in thyroid patients, we typically will find that it is lower than that. They really struggle to try to get to 98.6. A lot of thyroid patients, especially hypothyroid patients, would live chronically in the 97 range. 97.3, 97.6, 97.7, like they just struggle to get higher than that. And so when everybody is feeling normal, they're feeling cold, they're having cold hands and feet, they're constantly wearing extra shirts and extra jackets when everybody feels comfortable. So those are some signs that this patient, the thyroid might not be doing so hot. So we also see in the extreme end where they're too hot all the time, right? Those patients that have way too much thyroid function, right? Hyperthyroidism, they will be hot all the time, right? Because their metabolism is so fast, like they're burning everything, right? So they feel hot all the time. So that can be a sign of, high functioning thyroid. It could also be hot flashes, right? So we have to check and make sure. So the other thing we see in thyroid disease is heart problems. So these patients will complain of palpitations, like irregular heartbeats. They will be doing nothing, all of a sudden their heart just starts racing. Or they will be hearing extra beats in their heart, lup, dup, lup, and some other sound, right? So we find that these patients routinely have this dysfunction because there is a lot of thyroid receptors on the heart. So when the thyroid is not working well, the heart's also not going to be working well, okay? Then CNS symptoms, right? Central nervous system, the brain, oh my God. So when the patients have thyroid disease, unfortunately, a lot of them get diagnosed with depression and anxiety. Why? Because it affects the mood. They have brain fog. It's like they have a thought and they can't get it out. They keep forgetting stuff. Memory is a problem. Why? Because the brain really relies on this thyroid hormone to function well, right? So when the thyroid hormone is not optimal, the brain's not going to be optimal. Patients are going to be irritable, they're going to be moody, they're going to be down, they're going to be anxious, going to have panic attacks. I mean, just name it. Okay, so central nervous system dysfunction, very commonly seen in thyroid dysfunction. Also, reproductive problem. In fact, this can be a trigger. This is sometimes how we find some patients' thyroid problem is that they just can't seem to, they have fertility problems. They can't seem to hold on to pregnancy. Multiple spontaneous abortions in the first trimester. Just constantly losing the baby, losing the baby, losing the baby. And you know how much that weighs on a woman? Your psyche, like you feel depressed. You keep wondering what you did to hurt that baby, that why that baby couldn't stay. And all from the beginning, it's not even your fault. It's that your thyroid hormone is not optimal. So this is something we take really, really seriously. Once we start seeing fertility problems, we have to do an expanded thyroid test. Okay, so bone health. Women with low thyroid function, more likely to develop osteopenia, more likely to develop osteoporosis. Why? Because again, thyroid receptors on those bone tissue. The thyroid will signal for you to start taking that vitamin D up, that calcium up, and start making bone, okay? When you don't have thyroid hormone, that's not happening, okay? So let's talk about that. Now, cholesterol level. There have been some patients that I've found in my practice that have been put on cholesterol lowering medications for years and years. And they've been told, probably just runs in your family, so, we're gonna treat it. Well, what I found is that patients that have abnormal functioning thyroid are going to have abnormal functioning thyroid cholesterol levels. So in fact, when we start getting their thyroid level corrected, all of a sudden their cholesterol level starts to improve. So I like to make sure that that is not a cause of your high cholesterol level before I put you on a statin drug for your cholesterol. I mean, outside of eating better and making sure you're not putting the wrong oils and stuff in your body, cholesterol problems can also be a sign of thyroid dysfunction. And then this one, skin, hair, nails. A lot of women, this is actually what brings them in. Very unique thing that we see. Your hair is falling out in clumps. Like you just combing in, it's falling out, combing in, falling out, combing in, falling out, right? Sometimes you try not to even wash it or comb it to try to preserve it, and it still comes out, right? Or you can't seem to grow that third part of your eyebrow. Right? It's so thin there or it's nothing there. Okay? That's a very unique sign of thyroid dysfunction. Okay? Your nails are so brittle, always constantly falling out, breaking and cracking. Right? Outside of not eating enough protein, not having enough nutrition, or being B vitamin deficient, thyroid can be the other cause. Okay? So those are some of the things that we see in patients that have thyroid dysfunction. Hope this video has been helpful. If you're having any of those signs, please, 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 please have your doctor run an expanded thyroid panel. Not just TSH, not just T4. We need to see the free T4. We need to see the free T3. We need to see the thyroid antibodies, okay? Hope that's been helpful.